So, if you are new to this channel, I am Dr. Himadri. Let's talk about your clonidine. Okay. So, what is clonidine? Clonidine is actually centrally acting alpha 2 receptor agonist, specifically speaking alpha 2A. Okay, and this is also having very high affinity and high intrinsic activity. So, this clonidine actually is our centrally acting antihypertensive drug. Look here, this is the classification of antihypertensive drug. Diuretics comes first, that is your Lasix, followed by AC inhibitor, your and AT1 receptor blocker, calcium channel blocker, and in the lower in the list you have central sympatholytics like clonidine. So, what is the mechanism of action of clonidine? You know, this is centrally acting. Look here, this is your beautiful central nervous system, and here is your hypothalamus, and within the hypothalamus you have the sympathetic sympathetic headmaster. The sympathetic headmaster comes via here, and here is your medullary vasomotor center, and from where the sympathetic flow is actually coming down. So this clonidine is actually acting in the medullary vasomotor center, specifically speaking post-junctionally in the alpha 2 receptor, and this alpha 2 receptor is internally coupled with G inhibitory. Therefore it leads to inhibition of the sympathetic flow. Therefore there is inhibition of the sympathetic flow. Look here, this is your beautiful heart. This heart is actually under two different types of control. One is your sympathetic and another is your vagus control, which is parasympathetic. So the sympathetic system actually normally, if it acts normally, it leads to increase in heart rate and increase in BP. But whereas your vagus system leads to suppression of this, therefore there is bradycardia and low BP. So what happens, as the sympathetic system is under inhibition, your vagus system automatically acts much more, leading to reduced heart rate and reduced BP. So there is another thing that you need to understand. You have understood the central vasomotor center control in the medulla. You should know that in the peripheral nervous system, clonidine is also acting in this region. Look here, this is, suppose a nerve is coming. Okay, so your clonidine is low. At first you should understand the normal thing. So what is happening, your impulse is coming. When impulse is coming, it leads to activation of this calcium channel. It is called as voltage gated calcium channel, as it is activated by voltage. Okay, so in the preformed vesicle within the nerve ending you have norepinephrine. Okay, so when the calcium comes, it binds with this molecule. As calcium is positively charged, it leads to repulsion. So because of this repulsion, there is a docking. So synaptobrevin and syntaxin complex forms, and this vesicle norepinephrine basically after docking leads to degranulation, and this norepinephrine can act in different receptors. If it acts in the alpha 1 receptor in the blood vessel, it leads to vasoconstriction. If it acts over via beta 1 receptor in the heart, it leads to increased heart rate and increased contractility. Okay, so another thing you should understand, that this is the normal, but you need to understand what is actually happening if we use clonidine. Clonidine is actually acting via alpha 2 receptor presynaptically. Look here, in the vasomotor center it was acting post-synaptically, but whereas in the nerve endings it acts in the presynaptically. Okay, so this clonidine acting here and via G inhibitory receptor, it is actually inhibiting the conversion of your ATP to cyclic AMP. Therefore cyclic AMP is basically going down. As there is reduced amount of cyclic AMP, it also inhibits this calcium channel, voltage gated calcium channel. So calcium cannot enter within the nerve terminals, and whereas it also increases the activity of potassium channel. And you know, because of this activity, potassium actually loves to go outside the nerve endings, leads to hyperpolarization. So this nerve cannot be excited anymore. Therefore this norepinephrine cannot degranulate. Therefore it leads to inhibition of the sympathetic system. Okay, so the ultimate result is no sympathetic outflow, rather inhibition, and therefore there is reduced heart rate as well as vasodilatation. So another thing, look here, this is our heart, and this is your arterial system, and this is your venous system which is draining into the heart. So what is actually happening here? So because of the sympathrolytic activity, there is reduced heart rate and reduced contractility, as well as there is vasodilatation. Via alpha 1 receptor, norepinephrine cannot act, therefore vasodilatation. There is reduced venous return, therefore BP, the diastolic BP will fall, as well as there is vasodilatation in the arterial side as well. There will be reduced total peripheral resistance. Okay, so there is total peripheral resistance is reduced, automatically your BP will be reduced. So ultimately BP will reduce, therefore we call it as centrally acting anti-hypertensive drug. So what are the uses apart from this? Apart from reduction in BP, it also, look here, there are some few diseases which are associated with increased sympathetic activity, like ADHD, attention deficit hyperactivity disorder in children. Okay, so this hyperactivity is due to excessive sympathetic activity, as clonidine leads to sympatholysis, therefore we can use in ADHD. Number 2 is tics associated with Tourette syndrome. In the tics there is involuntary repetitive movement which are non-rhythmic. So this is also due to your excessive sympathetic activity. So clonidine can be used here, as well as because of excessive sympathetic trigger there may be migraine. So we can use clonidine as migraine prophylaxis. Another thing you should know that these are all centrally acting. Some in the spinal cord, there are some other things. Yes, in the spinal cord, if clonidine acts, it leads to some another mechanism of action is present here as well. It reduces the nociception, as well as it reduces the NMDA activity, and therefore this due to reduction of this NMDA activation, automatically it reduces pain. Therefore we can use in epidural route for management of pain. So what are the side effects after use? You should know the side effect. As there is two system, one is sympathetic system and another is your parasympathetic system. As the sympathetic system is not working, parasympathetic system will automatically work more. Therefore dry mouth, constipation, these are due to your sympathrolytic activity. These are basically your side effects, as well as because of this central suppression activity, automatically there will be drowsiness and sleepiness. And remember, clonidine is actually doing your reduction in heart rate. If it reduces the heart rate further, it will lead to bradycardia, and if abruptly this drug is stopped, it will lead to rebound hypertension. Okay, so what are the doses? Formulation, the drug formulation is actually oral, as well as we have transdermal patches, clonidine transdermal patch, or we can give the drug in IV. Okay, so clonidine tablet is available in 100 microgram. So the dose is actually 100 microgram OD to 100 microgram BD. Okay, in children, especially in ADHD, the dose is 100 microgram OD at bedtime. Okay, so thank you. If you are still watching me, you could have liked this video. For more such video, subscribe and also share with your friends.